All right, so let's finish up and talk about the actual lower extremity. Okay, now very similar pattern in the lower extremities we saw in the upper extremity. Okay, so we saw in the upper extremity the humerus makes up the shoulder joint. That's only one bone. All right, well our femur makes up the hip joint. Okay, so you have one bone that is connecting, all right, each extremity, to the girdles. And then in our forearm, you had two bones in the forearm. Well, we have two bones in your leg, the tibia and the fibula. Okay. Now, one of the differences that we see is in the wrist, you had 8 bones, and those were called carpal bones. Well, in your foot, you have 7 tarsal bones. But all the rest is the same. In the palm of your hand, you had 5 metacarpal bones. All right. In your foot, you have 5 metatarsal bones. Then you had 14 phalanges in the hand. You have 14 phalanges in the foot. Another difference is the patella. That's a sesamoid bone. It's a bone that resides within a tendon. Okay. All right. So let's talk about the first bone of the of the lower extremity, the femur. Okay. So the femur bone is the longest, strongest bone in the body. Okay, and it's going to follow the similar type of scenario that the humerus had. All right, it's going to have a head that's going to articulate, all right, with the actual girdle. In this case, it's the pelvic girdle, all right, which is specifically the os coxa bone, but it forms that ball and cup, all right, joint that we see, all right, in the hip. The acetabulum is the cup, and the head of the femur, all right, is going to be the ball. Okay. On the very end of the head of the femur, right, you have this depression in there, and there's a ligament that comes out, and it connects to the acetabulum there. Okay, and that is called the fovea. In your lab manual, it's called the fovea capitis. Okay, and then just distal to the head, we have the neck. Okay, and the neck comes off at an angle. It's about a 45-degree angle. Don't quote me on that, but it's roughly about 45 degrees. Then you got your greater trochanter and the shaft. So a lot of downward force occurs here on the neck of the femur. So as you age and the bone density becomes less and less in this area here, it's more prone to shearing fractures. Okay. All right. So another structure on the proximal end of the femur is the greater trochanter. You'll feel that on the side of your hip. So if you feel a bony structure on the side of your leg there, or by your hip, that's the greater trochanter there. Okay. And the greater trochanter is a muscle attachment site for many muscles in your hip. Right? On the medial portion, on the inside of the femur, you have the lesser trochanter. Okay? And so the lesser trochanter is an attachment site for your iliopsoas muscle, and that is the strongest hip flexor muscle. And then between the lesser and greater trochanter, you have the intertrochanteric crest, right? And it's just this ridge-like structure that you'll see between the greater trochanter and then the lesser trochanter. All right. This stuff here you don't need to know for identification purposes, so we'll skip past that. Now we'll go down to the distal end of the femur, all right, and we'll see a couple different structures here. Okay. The medial and lateral condyles. Remember, a condyle is a rounded, smooth surface in which you're going to have a bony articulation with. Okay. I describe them as knuckles. All right, and there's a small space in between those knuckles, and that is called the intercondylar fossa. All right, so that intercondylar fossa is this guy right here. And then your condyles are here and here. And then just above the condyles, you have these little bumps. We saw it in the humerus. Your funny bone was actually one of them. You had the medial epicondyle in the humerus. You have a medial and lateral epicondyle in the femur. Okay? All right. The next bone we're going to talk about is the patella, also known as the kneecap. It is the largest sesamoid bone, and it lives within a tendon, specifically the quadriceps. Excuse me. All right, thank you. Okay, so it attaches to the quadriceps tendon. All right, and well, I should say attaches. It actually lives in the quadriceps tendon. And again, it allows the movement of that tendon, all right, a much more, how do I want to say this, accessible, but it increases the amount of force that your quadriceps can generate in extension of your leg, all right? And there's one of the things that they talk about with the patella is you have your quadriceps muscles here, and they give off their tendon, and then you have the patella here. All right, and the patella attaches onto what's called the, I was going to say the ischial tuberosity, the tibial tuberosity, okay? And we discussed that a tendon attaches muscle to bone, right? And then a ligament attaches bone to bone. So you might see in some literature that this structure here is referred to as, all right, the quadriceps tendon. And then this structure down here, from the patella down to the tibia, that's referred to as the patellar ligament. Okay? But here's the thing. The patella is a sesamoid bone, and it lives in a tendon. So this whole thing, all this connective tissue here, could be one big tendon. Okay? Point being is, if the arrow was pointing, all right, to this area here, all right, and you put quadriceps tendon, I would accept it. Okay? All right. Anywho, here's the picture. Unfortunately, this is not in your atlas. All right, you only need to be able to identify the patella. Okay, this is the anterior view, the front of the patella. Okay, it's the part you see when someone's standing in front of you, and this is the back side of the patella, and you've got hyaline cartilage here. All right, again, because this is the part of the patella that's going to rub up against the knee there. All right, going down into the leg. Okay, where your femur resides, that is referred to as the thigh. All right, below the knee down to the ankle, that is called the leg. All right, you have two bones, parallel bones. All right, the tibia and the fibula. Okay, the tibia is the larger of the two. It's going to be the more of the weight-bearing bone, so it's going to be more on the medial side. All right, and then the smaller one, the thinner one, that's going to be the fibula. That's going to be on the lateral side. Okay, and the same situation as we saw in the forearm. There's an intraosseous membrane in between the two bones there, and it's going to act as a syndesmosis joint. Okay, so it acts for pivot. All right, but again, there's really not much pivotal movement between your tibia and fibula like you see in the radius and the ulna. Okay, very little. All right, so let's start off with the tibia, our first bone here. Okay, on the proximal end, this is by your knee. Okay, you have your medial and lateral condyles. Now here's the crazy part. All right, the medial and lateral condyles are actually flat surfaces. Okay, so normally when I've told you that a condyle is a rounded, smooth surface, it's a rounded, smooth surface, but it's more of a convexity instead of a concavity. Excuse me, it's more of a concavity instead of a convexity. This is a convex, all right? If we're looking at it from this angle, this is a concavity if we're looking at it from this angle, okay? Anyways, the point is the medial and lateral condyles of the tibia are going to accommodate the medial and lateral condyles of the femur, all right? And in between the two condyles of the tibia, you've got this structure here. You need to know that for identification purposes. It's called the intercondylar eminence. It looks like two little distant mountain peaks, okay? And it's a site for ligamentous attachment. All right, on the front side of the tibia, all right, just below the knee, you've got a bump there, okay, right here. And that's the tibial tuberosity. That's where that tendon, all right, attaches to. Okay, some people have an elongated, not an elongated bump, but a more pronounced bump there, and they have. Has anyone ever heard of Osgood-Schlatter's disease? Have you? Do you have it? Oh, okay. A good friend of mine has it too. It's just your tibial tuberosity is just a little bit more pronounced, and because a lot of going back to bone remodeling, a lot of tension is placed on this area here, and you put some tension on it. It excites the bone in that area. It grows more bone tissue, so it grows out more. All right, he used to be a catcher in baseball, and so he was squatting down and standing up a lot. So he did a lot of activity, and that irritated that area. It comes out. I mean, it's weird. His comes out, I'd say, almost. I'm exaggerating, almost an inch, but it's about that much. I don't know how much that would be, but it's out there. And every time I see him, I ask him, "Can I touch it? Can I touch it?" He lets me touch it sometimes. But it's just weird because it pokes out from the bone. I've never seen anybody with Osgood-Schlatter's like that. Anyways. All right. So going down to the distal portion of the tibia, you've got the medial malleolus. So what is the medial malleolus? Touch the inside of your ankle. There's a bone, a bump there. That's the medial malleolus. Okay? It's like a styloid process, but it's much larger, okay? So when you feel that inside of your ankle and you feel that bone there, that bump there, that's the medial malleolus, okay? All right, so let's look at the fibula now. This is the smaller non-weight-bearing bone that's lateral to the tibia. All right, it's real easy. There's only 3 things that we could possibly ask you what is on the fibula, all right? You've got the head, the neck, and the lateral malleolus. The head and the neck are the proximal portion. Okay, they're going to be closest to the knee. And then at the other end, the distal portion, the lateral malleolus, that's the bump on the outside of your ankle. So if you feel the outside of your ankle, there's a bump on the outside, that's the lateral malleolus. These medial and lateral malleoli, okay, they help to stabilize the ankle joint. Okay, the ankle joint is like a hinge joint. And so the bone that they articulate with is called the talus. And so the medial malleolus will attach to one side of the talus. Okay. And then the lateral malleolus will attach to the other side. And so it keeps the talus, the head of the talus, kind of sandwiched in between those 2 areas there. All right. So you can do, you can point your toes, you can move your toes up towards the ceiling there. All right, so it offers those malleoli offer stability to the ankle. All right, so here you can see a picture of both the bones together. All right, let's jump into the tarsals. We'll finish up here with the tarsal bones. All right, so in the wrist we had 8 bones. Okay, 2 rows of 4, a proximal and a distal row. All right, this time with the tarsals we only have 7. Okay. But we do have 2 rows, okay? We've got a proximal and a distal row, okay? So in our proximal row, we're going to see the talus, the calcaneus, which is your heel bone, and then the navicular bone, okay? So the talus is the bone that sits right on top of the foot, and it's going to be the bone that's pretty much going to make up your ankle joint, all right? So yes, it articulates with the tibia, but it also articulates with the fibula on the lateral portion there. All right, your heel bone, all right, that's the calcaneus, and that is where, and you need to know this, where your Achilles tendon attaches onto, all right? Or we also call it the calcaneal tendon. You can call it either or, Achilles tendon or calcaneal tendon. All right, but that attaches onto your heel, all right? And then on the medial side of your ankle, we have the navicular bone. So I'll show it to you in a second. Let me just wrap up the tarsals here with the distal row. All right, the distal row has 4 bones in it. Okay, and those are called 3 out of 4 they're called cuneiform bones. You have the medial, the intermediate and the lateral cuneiform bones. All right, and then at the lateral portion, we got the cuboid. Okay, and the cuboid actually will attach onto two of the metatarsal bones. All right, so let's take a peek real quick. Here you can see, here's the talus. This is a superior view. All right, and then if we flip over the foot, all right, you can see from the inferior view, you can see the talus up over here. Here's your calcaneus. All right, this is the superior view of your foot. That's your heel. Here you can see it on the inferior view. All right, and then the other bone that's in the proximal row is the navicular bone. So here's the talus, here's the calcaneus, then you can see the navicular bone right here. And then you've got a row of 4 bones right here. And those are going to be your cuneiform bones. You got your medial cuneiform, intermediate, and then lateral. And then you got one bone all the way over here by digits 4 and 5, and that's your cuboid bone. All right, we'll go through all this. All right, now, you're not going to really learn anything new here, all right, except that instead of saying metacarpals, we say metatarsals. All right, same scenario. All right, these are the bones, one that, you know, the metacarpals formed the palm of your hand. These bones form the arches in your foot. And we label them the same way we did in the hand, Roman numerals 1 through 5. Okay, and we do it the same way. We go medial to lateral. So you can look at your own foot. You see where the big toe is, that's medial. So your big toe, all right, the hallux, is metatarsal number 1. Your pinky toe side will be metatarsal number 5. All right, do you guys see that? Do you understand how that goes? I'll show you. All right, just in case you're wondering. All right, here you can see, this is the medial side. You can look at yourself. All right, your big toe is in the middle. Your pinky toe is on the lateral portion, okay, in the anatomical position. So that means, all right, that the first metatarsal is metatarsal 1. That's your big toe. Second will be, I don't know what they call it. It's the index finger in your hand. I mean, is it your pointer toe and your finger and your foot? I don't know, but it'll be the second toe. All right, and then you can see your pinky toe is metatarsal number 5. Okay, so we go from the inside, we work our way out to the lateral part. Same thing with the phalanges. Okay, you have 14 phalange bones in your foot. You have 14 phalange bones in your hand. Okay, all the toes have a proximal phalange. All the toes have a distal phalange. Toes 2, 3, 4, and 5 have middle phalanges. Okay, same, all right, pattern, all right, with your toes as you saw in the hand. There's nothing new to learn here. So you see here, okay, you can see all these toes that have a proximal phalange, all 5, and all 5 have a distal phalange. But only digits 2, 3, 4, and 5 have a middle phalange. Can you believe that your pinky toe has 3 phalanges in it? Isn't that freaky? It's so small. Yeah, I know. It's like a baby thumb, not even as big as a baby thumb, but it's, yeah. All right, let's do some labeling. Okay, baby. All right, let's jump right in and hit up the femur. Okay, so same type of thing in the lower extremities we saw in the upper extremity. All right, most of the slides will have 2 views, a full bone, all right, image, and then a partial bone. Okay, so you can see, here's the femoral head. Now, which side is the medial side of this bone and which side is the lateral side of the bone? our right will be the medial or lateral side. Okay, right on, good. And then this side will be the medial, is that correct? Now why do you say that? Good, perfect, yep, the head. Look for the head, it's going to articulate medially. That's going to be your medial side. Just to let you know also, this view is an anterior view of the femur, okay? The distal portion down here, the distal epiphysis, that's where the condyles are. You can't see them very well. They're down here. You see it much better on the posterior view. And when I show you a posterior view, you'll know what I mean. All right, so that's the femoral head, or the head of the femur. Okay, here you can see it on the, this is a posterior view. If you go down, all right, to the distal portion here, you can see those condyles much better. All right, here's one. Here's the other. You see it way better on this slide than you do on this slide. Agreed? Look at that. You can't even see them. Okay? So that's the femoral head, all right, on the posterior view. All right, so we'll flip it on over. All right, this little indentation that you see up here, okay, that's the fovea capitis. Now, if you were to look dead on at the head of the femur here, you would see an indentation here. And that's the fovea capitis. That was that ligament I was telling you that comes out of the head and it sticks onto the acetabulum. Okay, so the part of the bone that's adjacent to the head is the neck. All right, that's the neck of the femur. And then you can see it here on the posterior view. All right, so the head and the neck are medial. The greater trochanter is going to be lateral. Okay, this is the lateral side, this is the medial side. So you're going to have a bunch of hip muscles, the gluteal muscles, thigh muscles will attach onto, all right, the greater trochanter there. All right, now I'll flip it over and you can see it from the posterior side. All right, so we see the greater trochanter. We can't forget about our other trochanter. That's the lesser trochanter. And then we'll show it to you from the posterior view. Okay, so let's slide down now to the inferior portion, or excuse me, well, yeah, the inferior portion, but the distal part of the bone. We'll go down to the distal epiphysis. This is a posterior view. Here's the medial condyle of the femur. So again, when you're taking the test, identify first where the head is. Then you know which is medial. And then just drop down. Okay? And you can see, all right, this is indicating the medial condyle, all right, the distal portion. All right, so then going to the other side, there's the lateral condyle. All right, so in the humerus, we saw epicondyles. We're going to see the same thing here in the femur. All right, so right above the condyles, depends on what side you are, we're on the same side as the head. So this is the medial epicondyle. And medial epicondyles are just sites for muscular attachment, much like we saw in the humerus. Okay, it's the medial condyle, and then on the other side, there's the lateral condyle. And then in between our condyles, intercondylar fossa. All right, you'll find your ACL and PCL. All right, anterior cruciate ligament, posterior cruciate ligaments. Those are the ligaments that add to joint stability for anterior and posterior sliding motion in your knee. Has anyone ever heard of the drawer test? So when you sit on you have someone you suspect a knee injury, so they're laying on their back, you haven't bend their knee, and you sit on their foot, stabilize their foot. And then you grab onto their calf muscles and you pull forward on the leg. And in a normal person, there shouldn't be any give in the knee. Then you push back. Again, in a normal person, shouldn't be any give. But if the anterior cruciate ligament is I almost said fractured. If it's busted up, okay, if it's severed, when you pull forward, the knee will slide forward. Not a lot, not like it'll completely come out, but it'll slide forward significantly. Then if the PCL, the posterior cruciate ligament, is damaged, and you push it back, it'll slide forward, it'll go back. I had a patient, this kid was, when I say huge, his legs were just massive. And so were his glutes, just a football player, lacrosse player. Anyways, he injured himself, and he passed all the orthopedic tests for cruciate ligament damage, and his knee was still hurting. And they're like, "There's no way." We had 3 different sports medicine people look at this, so they ordered an MRI, and sure enough, it was broken. It was busted, and he had so much muscle mass in his legs that his muscles took over the stability of the knee. It was actually a really kind of cool phenomenon. All right, you don't have this in your book, all right, but that is the patella, okay? So just kind of commit it to memory there, okay? That is the patella. All right, let's go on now into the leg and discuss, all right, the proximal epiphysis of the tibia. This is the medial bone, okay? So now, how do I know that this is the medial side? I know it's labeled as such, but how do you know? Looking at this bone, how would you know? Well, this is how I know, okay? I go down to the distal end. And just to let you know, these slides, the top part of the page is always going to be the proximal part of the bone. We won't put the bone on there upside down. You know what I mean? To really mess with you, we could, but we won't. All right, go down to the distal end, and you see this little nubbin here? That's that medial malleolus that I was telling you about, okay? That bump on the inside of your ankle. So look for that, okay? First of all, anytime a bone is thrown up here, your job will be so easy if you can just identify what bone it is, all right? Because some of the questions we'll ask you. But first thing you should do is look at it and just be like, is that the humerus? Is that the radius? What bone is this? So your first thing is find out what bone it is. Okay, it's the tibia. All right, no problem. I know I'm going to go down to the distal end, okay, and I'm going to look for the medial malleolus. Whatever side the medial malleolus is on, that's the medial side, okay? This is also an anterior view of the tibia because you can see the tibial tuberosity, this bump on the front, okay? We'll label that in a second. All right, here's the medial condyle on the posterior view. There's no tibial tuberosity here. So I know that that's the posterior view. All right, these condyles in the tibia can be confusing because you're thinking of a rounded, smooth structure, but it's not. All right, back to the anterior view. Okay, this is the lateral condyle. It is opposite of the medial malleolus. Right, that's the lateral condyle. Now we'll flip the bone over. We'll make the ischial tuberosity. Why I say ischial? We'll make the tibial tuberosity disappear. That's the lateral condyle. All right, and then you've got 2 small bumps. This is not a really good example, but these 2 small bumps in the middle, and that's going to be the intercondylar eminence. And that's the site, all right, where your anterior and your posterior cruciate ligaments will attach to on the tibia. Okay, so now let's just drop down a little bit on the front. Boom, there's the tibial tuberosity. That is where, all right, your quadriceps muscle, the quadriceps tendon attaches to, okay? All right, as we rush down to the distal end of the tibia, we see the medial malleolus. Here it is on the anterior view. And then we'll just flip it over. There's the posterior view. Okay, the next bone is the fibula. This is the skinny one. There's only 3 structures that you need to know. Okay? So this proximal epiphysis, that's the head. All right, and then right below it is the neck. Now there is a phenomenon there. There's a nerve that is in close proximity to the neck of the fibula. It's called the common peroneal nerve. Your sciatic nerve splits off into two nerve segments. You have the anterior tibial nerve, and then you've got the common peroneal nerve. Well, it travels in close proximity to the neck, and the neck's a relatively easy structure to fracture. So if you get hit from the side, bam, you break the neck, all right, you can sever the nerve, and you can have paralysis of the muscles in the lateral portion of your leg and lose all sensation. All right, and that's from one of the branches of your sciatic nerve. If we go all the way to the other end of the bone, there is the lateral malleolus, okay? Lateral malleolus, that is going to be the lateral stabilizing structure for your ankle joint. All right, the fibula is easy. There's only three parts. Yes, sir.
So is that like the, or like when I play the easiest broken or fracture release?
The collarbone, I'm sorry, the clavicle is the easiest bone to break in your body. This is up there.
Okay.
Yeah.
Because I know how long I've been in it, I've heard you.
Yep.
The most common leg fracture probably.
Especially if you take a blow from the lateral portion, like especially like in football, people are breaking their fibulas. But you can still walk if the fibula is fractured. It still hurts a lot because it's not a weight-bearing bone. But yeah, they'll still put you in a cast though. All right, here you can see the fibula, the lateral malleolus. I'm going to kind of draw out the fibula. It's hard to see. All right, so in between those blue lines, that's the fibula. Okay, so you can see that's the lateral malleolus. How do I know that's the lateral malleolus? I'm in the lateral portion of the foot. Couple of reasons. Here's your pinky toe. I don't see the big toe there. All right, this is the cuboid bone too. You'll know what that is in a moment. And you got a nice clear view of the calcaneus, this bone, your heel bone. Okay. Speaking of calcaneus, let's take a look. We're going to go into your tarsal bones now. Okay. There's two rows. We're going to talk about the proximal row first. So that's the calcaneus, the talus here, and the navicular bone. Okay. And then your distal row are the cuneiforms and the cuboid bone. Okay, so there's the distal row, and then this is the proximal row. It's kind of a weird configuration, but whatever. All right, so this is a superior view of the foot. Here's the heel. This is where, all right, your Achilles tendon or your calcaneal tendon attaches onto, right there. Okay, so we'll show you the calcaneus from the from the medial view. Here you can see it much better. This is the medial view because I can see this is the big toe right here. And this is the medial malleolus of the tibia. All right, so this is all the calcaneus right back here. Okay. Calcaneus has got one of the cool sounding structures. You don't need to know it. It's called the sustentaculum tali. Try saying that real fast. But that's this little ridge here. You don't have to know it, but it's still cool. All right. So this dome-like bone here, okay, that is your talus. Okay, that is one of the bones that makes up your ankle joint. So you'll have on the medial side, the medial malleolus on this side, and on the lateral side, you'll have the lateral malleolus on this side. Okay, so there's the talus there. Here we can see it from the medial view, and I'll kind of highlight it here for you. All right, that's the talus. All right, then the last bone in the proximal row, just anterior to the talus, that's the navicular bone. Okay. And here it is on the medial view. Good so far? Getting some good labeling in? Okay. All right, the last row. All right, that's the distal row. Okay, so now look, you can do it one of two ways when you're labeling this. Okay, you can either call it the medial cuneiform, okay, or you can call it cuneiform number Roman numeral 1. It's up to you. Okay, up to you. But we're going to start with the first digit here. Okay, so that's the medial cuneiform. All right, the cuneiforms only articulate with one toe each. So you can see the medial cuneiform from the superior view here. You can also see it from the medial view right here. All right. Medial cuneiform or cuneiform Roman numeral 1. All right, so the next bone over, all right, is the intermediate cuneiform or cuneiform 2. And then the next bone over is the last cuneiform. That's the lateral cuneiform or cuneiform 3. So your medial, intermediate, and lateral cuneiform each only articulate with one toe. The last bone in the distal tarsal row articulates with 2, and that's the cuboid bone. Okay? It articulates with digits 4 and 5. You can see it from the superior view here, and then you can also see it from the lateral view here. All right, now here comes the easy part. Ready? Here we go. Metatarsals. Metatarsal number 1. Okay, this is going to be the arch of your foot. Starting with the big toe. Metatarsal number 2. Does anyone know what it's called when your second toe is longer than your big toe? Morton. Well, you're close. What did you call him, Mortimer?
That's what my mom always said.
It's close. Mortimer, all right. Yeah, it's a Morton's toe. There's actually a condition called Morton's neuroma, and you have nerves that go on either side of your toes there. And what happens is you get I don't want to call it calcium buildup, but you get like a fibrous tissue buildup there. It presses on the nerve, and it can cause significant pain, and it can cause numbness there. A lot of times what they'll do is you have these ligaments that cross over these bones here, and they'll clip the ligament there. And then it releases the nerve, so there's room there. But not so much. Men don't have to worry about this as much, but ladies, you do, because some women like to wear high-heeled. You know, I don't have a problem with like maybe an inch, but I'm talking about like 4-6 inch heel, and that causes your foot to bend, and it puts you know, about a 50-60 degree bend right there, right along this region right here, and that can irritate that tissue there. And I only know about Morton's neuromas because I had to write a paper on it. All right, third digit here, metatarsal number 3. I was very, very unenthusiastic about having to write that paper. I thought I was going to get something cool. It's a random thing. You reach in the hat, pull out a medical condition. You're like, yeah, I can't wait. I'm hoping I'm going to get something cool, like rheumatoid arthritis or something. Morton's neuroma. What the heck is that? But anyways, it's come up many times. All right, metatarsal 3, and then metatarsal 4. All right, and then the last one here, metatarsal 5. Okay? And you can see metatarsal 5 also on the lateral view. Your fifth metatarsal's got a funny little structure that hangs off of here. That's a frequently fractured bone. All right? When you fracture it, it's called a Ganser's fracture because you got a ligament that hangs out there or tendon, and it can cause an avulsion fracture. If you ever fracture this part of your calcaneus, they call that a hatchet fracture. Anyone heard of a hatchet? It was easy to remember because I always thought that the calcaneus looked like a hatchet head. All right, let's finish up with the phalanges. Okay, remember, all the toes have a proximal phalange. All the toes have a distal phalange. Okay? So the first phalange in the big toe is proximal phalanx 1. And we're not going to go through all these. I'll let you label the rest. Okay? But these are all these are the proximal phalanx. I'll show you another one. Here's the proximal phalanx 2. All right, then we're going to skip all the way to the end for the lateral view. There's proximal phalanx 5. Look how small this little bone is here, that distal phalanx. So baby. All right, so let me show you the middle phalanx now. Okay, so here's the middle phalanx for digits 2, 3, 4, and 5. Oops. It's a little bit easier to see. There's the middle phalanx for digit 4. Here's the middle phalanx for digit 5. Okay? And then you can see the middle phalanx on the lateral view here. All right, then finally, distal phalanx. Distal phalanx 1, distal phalanx 2, distal phalanx 3, distal phalanx 4, distal phalanx 5. I'll show you the second one here. And then finally, without further ado, distal phalanx 5. The last of the bones that you have to know. How's that feel? Does that feel good? You're done. You're done with the bones. All right? A lot of stuff, a lot of information there. All right? I highly encourage you, if you've not taken the lab mock exam, take that thing. So one more time, the middle ones have how many? Oh, the middle phalanx. If you're talking about the middle phalange, yes, there's 4 middle phalanges, and that's found in your 2nd through 5th toes. Okay, the big toe, all right, only has 2 phalanges, a proximal and a distal. So make sure that you've taken the mock. Well, try it. All right. For those of you, you're very welcome, Zach. For those of you that have taken it, you know what I'm talking about. It's a good practice, and you can take it again a second time, and it'll be a little bit different because it randomizes it for you, and then it gives you an idea of what you need to work on. Okay, I would use the Quizlets, okay, too, to help out. Look at your atlas, okay, between all that, and there's even those YouTube videos that are also in the supplemental lab and lecture folders in each chapter. If you want to go back and just look at the slides, okay? So there's lots of resources. So manage your time well. Any questions? Anything that comes to mind? Any questions at home? Do you guys hear me when I say that when you're at home? Okay, Heather, you got a question. Okay. Well, I'm going to stop recording here. No, I was saying that here. Oh, all right, all right. I'm going to